Hello, this is Dr. Gabe from First Look MRI, and this is a 44-year-old male who complained of right-sided hip pain for several years. It was worse when he tried to lift his knee towards his chest. He felt some pain and limited mobility, and this is a finding that is just incidental. He had no pain on the left side, but he did have an asymmetry. This is a view of the pelvis where we can see the left hip area over here. This is below the hip. This is the femur. And there's a little area here off the bottom of the femur called the lesser trochanter. And the lesser trochanter is very close to the ischium here. So in this view, there's a distance between the lesser trochanter and ischium. This is called the ischiofemoral space, and there should be about 13 millimeters or so, and this is less than 1 centimeter. So the muscle that comes through here, called the quadratus femoris muscle, gets pinched when this space is too narrow. And when it gets pinched, this muscle can become edematous or become atrophic. Sometimes it can even bleed. So this is what we call ischiofemoral impingement, where these two bones are too close. On the right-hand side, you see you have a lot of distance here, so this muscle has lots of room to pass in between here. But again, this is incidental. The patient didn't complain of pain over here, but this can cause a left-sided buttock pain. But the patient did have one other finding that explained their symptoms, which is over here. Now we're up into the hip joint. We see the right femoral head and the left femoral head, and you can see the difference. This is a nice rounded femoral head, and you can imagine the cup it rotates in here. This is called the acetabulum. The cup is very round, the ball is very round, so the ball and socket are both the same contour. Rotates freely, but over here you see the bony protuberance. This is the lateral front side of the femoral head. Instead of being rounded, it has a broad bony protuberance, like a cam off a camshaft. So we call this a CAM type, C-A-M type, femoroacetabular impingement. This is the femur. The cup is the acetabulum, and so the femur pinches into this. And this is a nice example how prominent that bony protuberance is here along the front, and on the other side how nice and smooth everything is. So an example of CAM type femoroacetabular impingement. We can see it on this view as well. This is a view where you can see the left femoral head nice and round, and here's the socket it sits in, the ball and socket. It looks nice and round, but over here you see this broadening, flattening out here. Instead of being rounded, it has a flat outer margin. You can see how when the patient lifts their hip outwards, it's going to pinch into here, or if they lift their hip forward, it's going to pinch into here, and that can cause tears or injuries of the labrum, which is a little piece of tissue right along the rim of the cup here. Sometimes it will cause bone erosions here, or sometimes just restricted movement. They try to lift up and it starts to pinch and they stop, but here's that broad protuberance. So this is called a CAM type femoroacetabular impingement. They can also have what's called a pincer type, where the acetabulum is too big and large. It'll hang over and can pinch into the femoral head. Sometimes they have a combined form where they have this broad protuberance here and flattening, and they also have an acetabulum that's too large, and then we call it a mixed CAM and pincer type femoroacetabular impingement. So 2 findings, and thank you very much.